Hello and welcome to Wellbeing. I'm Jack Hodgins. Today we'll be discussing the well-being of health workers during COVID. We are joined by Mark Aitkin, who is the Stakeholder Engagement Manager for Nurse and Midwife Support at Eastern Health. Eastern Health is one of Melbourne's largest metropolitan public health services, with many locations across the area. Hello Mark, and welcome to the program.
Hi Jack, great to be here today to talk about this important subject.
How important are healthcare workers to our society?
Oh, well, vitally important, Jack. I've been a registered nurse for 37 years and there hasn't been a day in my career where I haven't loved what I do or felt important in relation to the work that I do. So without healthcare workers, and specifically I'm talking about nurses and midwives because I'm a registered nurse, I don't think society would function at all. We're kind of core to the health, well-being and care of people who live in our cultures and our societies. And nurses, midwives and students are often in places, remote and distant locations throughout this country where there is no other healthcare professional or service. So if you need a nurse or a midwife, chances are we'll be there.
You work at Eastern Health. What is your role there?
Yeah, so it's actually a little bit more complicated than that, Jack. So Nurse and Midwife Support is the national support service for nurses, midwives and students. And Turning Point is a service of Eastern Health. And Turning Point provides drug and alcohol addiction support services for Australians and have done that for many years. A lot of those services are telephone-based services, as is Nurse and Midwife Support. I'm actually employed by the Nursing Midwifery Health Program Victoria and subcontracted to provide the stakeholder engagement for nurse and midwife support, to develop professional content that's available on our website, nmsupport.org.au, and to oversee the professional development for the team of clinicians who are mostly nurses and midwives who will answer the phone to a nurse or a midwife or anyone concerned about our welfare contacting the service.
What made you get into this line of work?
Well, I see this, Jack, as the pivotal point or culmination of my very long career. And there were many times in my 37-year career where I would have loved to have had a support service that I could have contacted. So when the opportunity became available 4.5 years ago to set up the service and work with a team to set up the service and then to consolidate and sustain that service, I jumped at the opportunity. Because in my very eclectic career, I've worked in many and varied areas of healthcare, community care and aged care. But the one constant in my career is that I've been a registered nurse. I'm incredibly proud of the profession, passionate about supporting nurses, midwives and students. And I just feel in the twilight of my career, I'm in the place that I need to be to really promote the importance of nurses, midwives and students reaching out for support whenever they need it and focusing on their health, well-being and self-care.
And with that support service, how has COVID affected that?
Well, COVID's made our service busier because, as you would appreciate, nurses and midwives and students have been and are on the front line of this pandemic, supporting, caring for and treating people either worried about COVID-19 or with COVID-19. And it's required a massive elevation in the services that nurses and midwives provide. I think it's also raised the profile of nurses and midwives and how fundamental they are to the health and well-being of people throughout Australia.
With the exposure to germs and diseases being prevalent in the health sector, is contracting COVID-19 a big worry for those working in the health sector?
Oh yes, no doubt it is a concern to nurses and midwives. We are specifically trained in infection prevention and infection control. So in many ways that protects us. There's certainly been a lot of training in relation to the use of PPE, personal protective equipment, and there's been an increase in the provision and availability of that equipment. Now, I wouldn't say that the sector has always, or the government has always got that right. throughout the pandemic. There were times, particularly early on, where there wasn't enough provision of PPE or the training didn't keep pace with the requirement of nurses and midwives to care for people. But at this stage, 18 months into the pandemic, nurses and midwives are very highly trained and skilled to manage infection and prevent infection and indeed prevent getting COVID-19 themselves. But in saying that, Jack, many nurses and midwives have contracted COVID-19 in the course of their work, and that is a very difficult thing. And I'm always sorry to hear of a nurse, midwife or student who contracts COVID-19, and indeed anyone who contracts COVID-19, because we still don't know everything we need to know about this disease, and we're hearing stories of long COVID. As well as that, we've heard terrible stories from countries overseas where nurses and midwives have died as a result of the complications of COVID-19. So it's very difficult as a nurse or a midwife working on the front line to hear those things and to not internalise them and to experience them as distress, anxiety or fear. So very complicated emotions. What I hear as nurses and midwives have been on are on an emotional roller coaster with COVID-19, as is a lot of the population.
You're listening to Wellbeing, where we are discussing the well-being of health workers during the pandemic. My guest today is Mark Aitkin. And how has the workloads been affected by COVID? How has that affected the well-being of our nurses and our midwives?
Yeah, I think, Jack, it depends on the area that you work in as a nurse or a midwife as a student. Being a nurse or a midwife is a broad church. There's many and varied areas that you can work in. I mean, many people work for the government in contact tracing. Many are doing COVID testing. Many are doing vaccination administration and coordination. And many are working on specific COVID-19 wards. And many are caring for people with COVID-19 in intensive care units. And, of course, midwives are continuing to support women and families with the delivery of their babies and then the ongoing support. It depends. Workloads for many have increased. What we're hearing, Jack, is that people are stressed, they're fatigued, and indeed they're exhausted. Because on top of that, being a nurse or a midwife or a student doesn't bulletproof you from human emotions and vulnerabilities and fragilities. People kind of often put nurses and midwives on a pedestal, but at the end of the day, we're people with lives just as everyone else has their life. So many people are needing to do their job while they homeschool, support elderly parents or relatives or friends. Often when you're a nurse or a midwife, you are the person in other people's worlds that actually sort things out or they go to for information and support. So I think for many that's an added pressure as well.
Do people working in healthcare feel like they are valued by society?
Yeah, it's a good question, Jack. I'm not sure I do this job or I'm part of this profession to feel valued. I guess what I want kind of more, respect is a value. I like to think that I was respected for my education, the fact that nurses and midwives have degree qualifications. Most of us have one, if not multiple, postgraduate qualifications. We're a professional group, so we registered with APRA every year and are required to do that. As part of that, we have to do a certain number of continuing professional development hours, and we have to be fit to practice. So we have to look after our own health and well-being. I guess that might come with a sense of value, but I think it's good the more we discuss this issue and put it out there that nurses and midwives are highly educated people, and with that, we'd like to think that people respect what we do and give some consideration to the way they interact with nurses and midwives. And so if you're on the precipice of projecting your anger, your frustration, your fear, then I would encourage you to take a deep breath and think that that is not the best way to interact with somebody, and that this person you're interacting with is giving their expertise and their education and are caring for you to ensure that your health and well-being is maximised and you get the care and need you want. So yes, I suppose value is a good goal to aim for, but I guess it's really unpacking what that value means.
You mentioned a few times that the COVID-19 pandemic in some ways has raised the profile of health workers. Have you felt as a health worker that people have been supportive of you during the pandemic?
Yeah, we've heard that term healthcare heroes. A lot of nurses and midwives don't like that. I actually don't like it either, to be quite honest. I think sometimes when people kind of, say, oh, you're a hero, kind of puts you on a bit of a pedestal, or it kind of puts you in a situation where you always have to be that person. So, I might not be having such a great day yourself, and you might just, be able to go to work and do your job and not kind of elevate yourself to hero status. So I'd say what nurses and midwives want, rather than being seen as heroes, is that we want respect, as I said before. We want to be paid properly for the work we do, and we want to have good conditions. We want to have good workplace conditions that support our health and well-being.
And you mentioned the payment there. Are our healthcare workers paid enough, do you think?
Well, is anyone ever paid enough? I think maybe actors and sports people are. I don't know. I'm not one of those people. Look, I'd say most people, if you ask them if they were paid enough, would say that they could do with more money. We have a professional EBAs and awards that are negotiated with government, health services and employers and industrial organisations such as the ANMF. So I believe that I have good work conditions that not only include pay. I'm sure some nurses and midwives might say they wouldn't mind a bit more money, or maybe a pandemic supplement.
With around-the-clock hours, do you feel like you have a life away from work?
I don't do shift work anymore, Jack, so I do. I've kind of got to a place where I feel like I do have workplace balance. It hasn't always been like that for me. When I was doing shift work, I found some of the shift work very challenging, particularly when I worked in intensive care and I was doing a lot of rotations, so between day shift, afternoon shift and night shift. When I started many, many years ago, it was not unheard of for us to work 10 days in a row. I believe that doesn't happen as much anymore. I hope it doesn't, because that's not good for work-life balance. I actually had an experience of burnout when I worked in intensive care because part of the reason was the shift work, and part of the reason was the intensity of the work that I did. But shift work is challenging for many nurses and midwives. Some people love it, and some people it works for at particular times in their life. For instance, my sister is also a nurse, and she elected to do permanent night duty for a number of years while she raised her children, because that supported her, work-life balance. But I think if you asked most nurses and midwives, they would say at some point in their career, if not now, they didn't have work-life balance. So I think it's a goal we aim for. Sometimes we achieve it and sometimes we don't.
Would that imbalance overall be because there's not enough workers available?
Some of that would be related to supply. There is a shortage of nurses and midwives, and with the pandemic, we're not able to obviously have people come to work in Australia on immigration visas. So, and we're an older workforce, so as nurses and midwives start to retire or pull back their hours, then there's not enough nurses and midwives to replace them. We are experiencing a shortage, and I think that's another reason why it's vitally important that nurses and midwives look after themselves, but are also looked after and supported by their workplaces.
During this pandemic, what has been the most difficult experience for you in your job in the last 18 months?
I think it's hearing the complexity and the ongoing nature of some of these stories that nurses and midwives tell us. Some crisis, like a bushfire, for example, which we went through in certain parts of Australia prior to the pandemic, is short, sharp and destructive. And I know the impact of those bushfires are still being felt in many communities, but it's kind of like we can regroup and we can support and we can move on. But this pandemic has been going for 18 months. There's been many twists and turns, and there's been a sense that it hasn't all been as managed as well as it could have been. And, now we find ourselves with this very complex Delta wave that is, blowing out of control in New South Wales and in other parts of Australia. It's obviously caused lockdowns, but feels a bit more controlled. So I would say the intensity and the ongoing nature and complexity of this pandemic.
Has there been any challenging changes to your job that the pandemic has brought?
Yeah, well, I'm lucky enough that I can do my job from home because our service, Jack, is an online and telephone-based service. So any nurse, midwife or student can contact the service, 1-800-667-877, or via the website nmsupport.org.au. So prior to the pandemic, we were working in an office, and with the various lockdowns, and I'm in Melbourne and we're in lockdown at the moment, we're required to work from home because we can work from home. So that's been a big change. I feel lucky that I can do that because I feel safer than a lot of nurses and midwives do. But that has required a pivot and a big changes. And I think that comes with a lot of other complexities. Like, I miss, as many people do, the kind of face-to-face physical interaction. Prior to COVID-19, I was travelling Australia, promoting this really important service, and that's all stopped. So I've had to be quite creative about how I promote the service without being able to go to events, conferences. And, that's been kind of exciting on one level, opened up new opportunities on another, and kind of had challenges on another level. So, we're just kind of really doing what we need to do to make sure that every nurse, midwife and student and those who support us know about nurse and midwife support if and when they need support.
With the pandemic over time, has the conditions gotten better for the healthcare workers, or are we still a little bit not quite out of the woods in that area yet?
Yeah, I would say if you ask nurses in New South Wales at the moment, they wouldn't feel like their conditions were better. I think, again, it's quite individual, Jack. Like some workplaces have really got this right and are doing very well, and some are not where they need to be, and nurses and midwives don't feel, for the most part, supported. And again, this pandemic is, it's taken on a kind of trajectory of its own. So, we don't know where it's going to rear its ugly head and cause a cluster outbreak. And some hospitals and health services have been impacted. So staff have been furloughed and services had to, ramp down, or services had to be ramped up depending on the impact of the outbreak. So I think, again, quite individual. Some people would feel supported and some people haven't, and some people don't feel supported.
You're listening to Wellbeing, where we are discussing the well-being of health workers during the pandemic. My guest today is Mark Aitkin. We know all the negative things that have come along with COVID, but have there been any positive moments you've had in the last 18 months during the pandemic?
Oh, those COVID silver linings we're all looking for, Jack. Yes, very important question. Very important question. I think one of the silver linings for me has been hearing stories of support that nurses and midwives have and are providing to each other. And I think a lot of nurses and midwives would say it is their team, or it's their colleagues, or it's their nursing midwifery family or friends that have given them the most support. And they feel quite humbled by that. And they feel that that support is absolutely vital. And so those stories are really lovely, and people have done, really creative things. I mean, I don't know if you've connected with the Royal Melbourne Hospital Scrubs Choir, but, they've formed a choir and they've got together and they've created some beautiful music videos and singing to support people throughout the pandemic, but also give their staff the opportunity to interact and contribute in a different way. So there's some lovely examples of that, and I think it really makes your heart sing when you hear it.
Has all the hard work been worth it during the pandemic?
I'd say definitely, Jack. I think so. We have to look at it that way. That it is worth it. Otherwise, could cause a fair bit of despair. I mean, the reality is we're dealing with what we're dealing with, and we're at where we're at, and nurses and midwives are very good at stepping up. We're very good at just getting on with it, and we're very good at going above and beyond. And I think nurses and midwives would mostly believe that, the work they have done is important, it's appreciated, it's vital. It has been worth it because, Australia's done a lot better than a lot of other countries, and there might be things that we haven't got right, and we might not feel the vaccine rollout is exactly where it needs to be, but the reality is that we're not, when we haven't experienced the numbers of deaths that a lot of other countries have.
And I think you mentioned a very good point there when you highlighted how well we've done compared to other countries. I think, we sometimes in Australia, especially during COVID, we can some people could complain about, this and that, but really, overall, I think when you mentioned that point, we've really done well to some degree. I mean, we've had a few ups and downs, especially now in New South Wales, but overall, we're doing a lot better than other countries.
Yeah, we are, Jack, and I think, that again goes to the COVID silver lining is to, I guess feel grateful for the fact we've done what we've done, and we've, for the most part, done really well. But we still, in saying that, don't want to diminish the experience of people who are not doing well and are not okay and haven't had a great experience. If you've lost your job, or every member of your household has lost their job, or your business has suffered, or you've contracted COVID-19 and you've got long COVID, and you're anxious, depressed, or traumatized, then I guess you wouldn't maybe feel that, that you're doing well. And so I think we need to look at this in both ways. And I think the key here is acknowledging that whatever your experience, that is your experience, and that is how you are experiencing it. And if you're not travelling okay, then please reach out for support. If you're a nurse or a midwife, nurse and midwife support 24/7, no matter where you live in Australia, 1-800-667-877. But if you're not a nurse or a midwife, there's lots of other services you can contact, Lifeline being one of those. And I heard that Lifeline had their busiest day ever yesterday. So the chairman of Lifeline was speaking, and he was saying, well, at least people are reaching out for support. So I think that's a key point here, Jack. If anyone needs support and doesn't feel like that there's a COVID-19 silver lining, or doesn't feel able to acknowledge we've done really well, then please reach out for support.
What could be done to make the health sector better for all in the profession?
Oh, wow, Jack. That's a big question. Look, we do have a good, healthcare system in Australia. I mean, of course, it could always be better. We've just experienced that with an Aged Care Royal Commission. And I worked in aged care for many years, and was deeply sad to hear some of the stories that came out of the Royal Commission. So clearly we have opportunities for improvement. Mental health, there was a Royal Commission in Victoria in relation to mental health. Clearly there's a great need for improvement there as well. So I think there's been a focus put on areas of healthcare, aged care, community care and mental health where it needs a spotlight put on it. And we just need to take it on the chin as a society and say, we don't always get this right. We need to get it right because people deserve the best healthcare, aged care, mental health care that they can get. I think we all need to work in cultures of continuous improvement. So be open to feedback, to continue to listen and communicate. Strive to do our best and do better every day, which I know every nurse aims to do. What I say, Jack, is no nurse, midwife or student gets up, for their shift. They get out of bed for their shift to go to work and not the best care possible. However, there's many factors that can impact their ability to do that. And we just need to understand what those factors are, and we need to support people better to be able to do the important job they do.
What would be the take-home from this interview you'd want people to remember the most?
Your health matters, absolutely, Jack, is our tagline. And that is really important that people listening, whether you're a nurse, midwife or student, you connect with the fact that your health matters. That your health as a nurse, midwife, student is vitally, if not more important than anyone else's. Because if your health is not optimised or where it needs to be, you're not going to deliver the best care possible. So please connect with that message that everyone listening, your health matters. If you need support or you need help, please reach out. If you're a nurse, midwife or student or anyone concerned about our welfare, please contact Nurse and Midwife Support 1-800-667-877 or via the website nmsupport.org.au.
Well, thank you so much for sharing your insight with us today, Mark. We appreciate you taking the time.
My pleasure, Jack. And everyone out there, please look after yourselves and each other. Your health matters.
My guest today was Mark Aitkin, the Stakeholder Engagement Manager for Nurse and Midwife Support at Eastern Health in Melbourne. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.